When you see addiction treatment work, you can see lives really turn around in pretty incredible ways. People go from being very destitute, disenfranchised from their family, unable to hold a job, to, in a full recovery, really enjoying life.
At American Addiction Centers, we really take a multifactorial approach. That includes dealing with both the biological aspects of the disease and also the psychosocial, metaphysical, and spiritual aspects of the disease.
We have the entire core of education that we do with people when they come to us. We do extensive therapy groups, therapeutic process groups. We do individual therapy, we do family therapy. We have doctors on site at all facilities that are meeting with patients, frequently, especially early in care, on a daily basis.
When I was asked to become a part of American Addiction Centers, I really enjoyed their philosophy. I enjoyed how they, as a complete organization, wanted to transform addiction treatment. I really appreciated how they wanted to focus on that and provide a very high level of care for patients and be able to provide that for a very long period of time, to focus on all phases from acute medical detox and withdrawal management all the way through the residential treatment programming, partial hospitalization, intensive outpatient, and just a really multitude of therapies and interventions for people to really try to help them in every way for the longest possible time.
It's a very comprehensive model that addresses all aspects of addiction. So not just the substance use, but also their family functioning, psychiatric issues, trauma that they might experience, legal problems, employment problems. All of those are part of really providing a comprehensive service to address addiction.
A lot of times when people are using, they don't really see doctors or anybody or the healthcare system at all until things get really bad. So this really gives us an opportunity to take care of them, their complete person. And if there's something that we can't handle, well, at least we can identify it and we can refer them out or put it as a part of their discharge planning. But I think that benefits not only them, their families, but also society as a whole.
The mission of American Addiction Centers, short and simple, is to provide the best treatment possible for addiction. We want to really not only respect the tradition of addiction treatment as it exists, but also really bring the best of research, technology, innovation, genetics, those kinds of tools to make it even better in the coming years.
We treat the disease of addiction as a primary healthcare illness. We treat it as a biological phenomenon and try to address the person as you would any other illness associated in healthcare. We try to understand the biology, the physiology, the psychology of how it affects the person as a whole, and how to help them treat those symptoms and manage them and get them into remission.